who's at the Nasrec Expo Centre, where the ANC's National Policy Conference is underway. Shahan, economic transformation being discussed today. The question is it radical economic transformation or radical socio-economic transformation?
Well, Michelle, it depends who you ask. Of course, different members of the ANC have different things to say on that. Treasurer General Zweli Mkhize said that there was nothing really radical. It was more about inclusion and inclusive growth in South Africa. President Jacob Zuma, though, on the other hand, would argue that it is radical economic transformation because it's supposed to happen at a rapid pace to address inequality in South Africa. But also under discussion today is the health sector and, of course, specific focus on that for delegates at these commissions, which are happening behind closed doors. So let's get insight from the Health Minister himself and also on the subcommittee in this particular discussion document, Aaron Motsoaledi. Thanks so much for your time, Minister. We appreciate it. Of course, we know that you're taking the NHI white paper to Parliament. You've made huge headway in that. Let's talk, though, about you trying to re-engineer the primary healthcare system. And let's start off with schools. What's the consultation process looking in that regard?
Thank you very much, Shahan. Look, that part that talks about the engineering of the primary healthcare system is precisely because we said the NHI, the heartbeat of the NHI, is going to be primary healthcare. Meaning, you know, if you remove a heart from a body, that body dies. So it means it's going to be the living organism that drives NHI. It's going to be primary healthcare. What actually do we mean by primary healthcare? We mean a system that is characterized by three things. First and foremost, prevention of diseases. Because many South Africans seem to concentrate on curative healthcare. You didn't put this in the hospital, you didn't put this doctor, you didn't put that nurse, forgetting that diseases can actually be prevented and eradicated even before they need a hospital. So that is the first thing. The second thing is promotion of health. You are aware that the explosion of non-communicable diseases around the whole world, and even South Africa, can only be stopped if there is health promotion, people understanding what they must do, because the non-communicable diseases like hypertension, cancer, diabetes are diseases of lifestyle. So they need health promotion. The last is, it means a healthcare system where the entry point is at the levels lowest possible, not at the highest level as is happening in South Africa, which, by the way, is wrong. What do I mean? When people are sick, they can't just go directly to a specialist or to a teaching hospital like Chris Hani Baragwanath Hospital or Charlotte Macleod or Groote, as is the case. They must start at the lowest level of going to GPs and going to clinics. All those policies are in the white paper. And so that's what is meant by re-engineering of primary health care. Now, we re-engineer it in many ways. One of the most important ways of re-engineering primary health care is school health, because this is our argument. Let's look at things like these things I've mentioned, these diseases I've mentioned, including HIV/AIDS, including drugs and alcohol, including obesity, including all those. If you look at them, they start very early on in life. So we argued that there are 12 million kids going to school in South Africa every day. What is that which we are doing for them? At the present system, you just wait for them until they appear at hospital. That obviously is too late. But if you do something for them while they are still at school, that is primary health care at the best. So we said we are going to do 5 things for them. 1, check their physical barriers to learning. That means eyesight, hearing, oral hygiene, and speech. 2, check their immunization status and correct it there. 3, tell them about alcohol and drugs, things like Nyaube. You can't stop them in the villages. We have got to stop them right at school. The 4th program is reproductive health and right. You are aware of the explosion of teenage pregnancy you are dealing with. And the last one is HIV counseling and testing. Now, as I'm speaking, the first one we've already started in a big way. We have already finished screening 3.2 million school kids for eyesight, hearing, oral hygiene. And the results we got there has actually alarmed us.
So going forward, how realistic, though, is it to get to 12 million school children? Is that possible when the department struggles with the number of people going to hospitals and clinics already?
Actually, that's exactly what I was talking about. Because people believe health is when you go to hospital or clinic. And I'm telling you about going to schools, even in families. We've just finished 3.2 million kids. What will stop us from reaching 12 million? We will definitely reach them. Even in terms of ward-based primary healthcare teams, we have got teams which have been visiting families. They've already visited 4.7 million families, not individuals, families, where people go in, talk about health, check whether they've tested for HIV, AIDS or not. That's primary healthcare at its best. And by the way, don't think we are the only country that are thinking about that. The whole world have seen good virtues in that, and they want the whole world healthcare systems to move in that direction.
Now, what do you say to South Africans who are sitting at home saying to themselves that we have a problematic healthcare system still? The Gauteng Premier said that he believed the situation in the province was that we have hospitals that are in ICUs themselves. We have a pathology strike that affected people. We had the Life Esidimeni tragedy in Gauteng. Are we getting it right in terms of the running of hospitals and clinics, especially since we've been trying to address this for so long already?
Well, look, if you look the policy document on national health insurance, it outlines all those. The universal health coverage. We would not have come up with it if there are no problems. That's what people are missing. They believe universal health coverage is just a novel program of luxury. It's a program to solve problems. Even those problems we are mentioning, because many of them, by the way, are structural. It's not just a simple mismanagement or what, are structural problems of healthcare. Because we are running a healthcare system at the present moment where 4.4%. Let me start here. We are already spending 8.5% of the GDP on health, by the way, which is very high. Which is very high because the World Organization recommends that countries must spend at least 5% of their GDP on health. They will get good health outcomes. We are already at 8.5%. If you don't understand the significance of it, an average European country is at 9%. So we are just half a percentage below them. But we can't even compare our healthcare system, like you're saying, we're in the ICU, etc. If you compare us with BRICS countries, a country like Russia, which is far more advanced than us, is still at 5.4%.
China, well, the money's there then.
No, let me explain. Yeah, let me explain. Let me explain. Just be patient. China is still at 4.6%, and India at 4.2%. Now let's come to our question. Money is there, so why can't we see results? Precisely because out of 8.4, that 8.5%, 4.4% is spent on only 16% of the population. Only 16%, meaning out of every 100 people, we are helping only 16. You surely cannot believe that type of healthcare system can deliver. And the remaining 4.1% is saving 84% of the population. That is at the core of the system we call national health insurance, universal health coverage. Once we do that, then some of the things will start falling in place. So in the policy document, we outline exactly how we are going to do that. And by the way, the World Health Organization and the OECD in Europe have confirmed that we are the only country on the whole planet Earth that is spending so much money on so few people. There's no other country that is doing anything like that. Spending 4.4% of the GDP on only 16%, while we are spending 4.1 on 84%. It can't fly. And that is the core of what NHI wants to change. Why it can't fly? Because once you do that, your resources, human beings, always follow money. That's a rule of nature. It's a rule of the whole world. So if resources are concentrated on 16% of the population, all the skills, all the specialists, all the equipment, all the infrastructure, all the people who are trained will rush in that direction and leave 84% alone. And that's the problem that we are faced with now.
Minister, very quickly, I've run out of time. And because you're so good at elaborating on things, I want to ask you, since it's been brought up at the policy conference by several leaders, how do you feel about the motion of no confidence in President Jacob Zuma? Yesterday, Fikile Mbalula addressed the media, and he said that anyone who votes against the president is a suicide bomber and that there will be action taken.
Well, Shahan, I've expressed my views inside ANC meetings. Inside ANC meetings where I believe it matters, because I'm a member of the National Executive. This debate has come out many times, and I've expressed my views there very strongly, inside where it matters. Now, as to the motion of no confidence in Parliament, there are rules and regulations within ANC, within the caucus. I'll hear what is being said, but as an individual and as a member of the NEC, I'm sure it's well known what I've expressed there, out there in the NEC meetings.
Well, you were one of the people who wanted a motion of no confidence. That's what's been reported.
No. In the ANC, we don't talk about the motion of no confidence. We talk about either recalling a leader or not, as we did in 2008. And that's exactly what we're discussing. And because I believe the problem lies there, not in Parliament, as far as I'm concerned.
All right.
I believe it's the ANC and it itself which must solve this problem. If it fails to, well, it's a great pity. But that's where the problem ought to be solved. And that's where I participated.
So do you think the ANC is failing to address this issue then?
Well, we failed twice already.
All right. Thank you so much for that. Appreciate it. That was Aaron Motsoaledi, of course, on the subcommittee on education, health, science and technology. Back to you, Michelle.
All right. Thanks very much for that. Shahan Ramkasoon live to us there.